Hi, welcome to Fertility Talks. I'm Mary Wong, your host. And tonight we are going to be talking about wellness and self-care right now. And before we go into the meat of everything, it's actually going to be Zuzana Drakul who's going to be moderating this for us. We did it last time and it was so awesome. We're going to do this again. We have awesome guests, but she's going to go through that. But before we start, I just want to give you like a little preface of what Fertility Talks is about. This is live post number 161 or 162. Anyway, doesn't matter. Lots of posts and basically created to give you hope, provide you information that is grounded in science and with professionals and experts in the field of fertility so that you are not left astray or getting confused on Google with misinformation. So here we are today. So Zuzana, let's have you take over.
Thanks for the intro, Mary. So I am the co-founder of Book and Brunch, which is an online platform that allows anybody to host and attend book and food experiences. In this time, we're pivoting to virtual book and food experiences, so virtual book clubs. And we create a safe space. We create a space for networking, for connection, and just getting that meaningful connection over a book and a meal. And I am a former IVF patient at Create Fertility Clinic, currently 5 months pregnant, well, 5.5 now, and working with Mary to continue my healthy fertility journey. And we talk a lot about self-care. We talk a lot about wellness when we're in our sessions. So I'm happy to be here to moderate this. So anybody, we're live. There's comments at below us. So please comment and let us know if you have any questions. We're going to do a 20-minute chat with a couple questions between the four of us, and then we're going to go live with questions and answers and do another 20 minutes or 25 minutes. The whole chat Fertility Talk will be about an hour today. So we're going to try to keep it to the hour. Last time we would have been over. So any kind of questions that are answered, please leave them there. And one of you will be able to answer those after the fact. So I'm going to start with some bios. We're going to start with Mary Wong. She's been in practice for 27 years. She's the founder of Alive Holistic Health Center, author of Pathways to Pregnancy, one of my favorite books, and we could talk about that later, certified high performance coach, fertility strategist, creator and host of Fertility Talk, international speaker, acupuncturist, and former IVF patient who struggled with infertility. She sits on the Ontario government appointed expert panel for infertility and adoption. Next, we have Dr. Sharma. Sharma is American board certified RE, who's been practicing at Create Fertility for the last 12 years. She graduated from the prestigious Cornell and Columbia University before moving to Toronto to practice. She's the founder of the fertility blog, The Conception Diaries, and the medical advisor board chair at Lila, a novel home fertility testing company. So thank you for joining. And lastly, we have Jayne Silverman, has worked in the field of infertility for the past 28 years. Her passion is to support, educate, and advocate on behalf of those struggling with fertility challenges. For 21 years, Jen developed and then ran the infertility support and education program at Women's College Hospital. Over the past 7 years, she's been in private practice and consulted with Create Fertility Center and has personally struggled with infertility and made her family through adoption. Amazing. Thank you so much for joining today. And again, as Mary mentioned, we're here to discuss self-care and wellness now with your fertility and learning how we can marriage our fertility journey with your RE, counseling, and acupuncture during this time. I'm going to start with Dr. Sharma and ask, what is the most important thing to you during this time for the wellness and self-care of your fertility patients?
You know, I think we're in a really unique period of time right now with the whole COVID pandemic. But just, you know, outside of this time period, just in general, I think fertility treatment has really evolved. And whereas maybe 20 years ago, it was just all based on science, technology, and what happens in the laboratory, now there is so much data to support mental health, mental well-being, counseling, having someone there to discuss how you're feeling throughout the process, as well as having integrative medicine and naturopathy play a huge role in your fertility journey. There's lots of data to support things like acupuncture and Chinese herbs. So whenever I talk to a fertility patient, I always say, it's a whole body experience. It's not just the fertility drugs that we give you to make you make the eggs for IVF and extraction and creating embryos. It's also being in the perfect mindset and having your whole body ready to conceive. And then it's not just once you conceive, it's the whole pregnancy that you have to be in the right state of mental and physical well-being. Particularly in the challenging time that we're in right now, what we're telling patients while they're, for the most part, pausing their treatment is that this is a great time to focus on your mental and physical well-being and getting yourself really ready for that next step. And also being in constant touch with your fertility doctor to make sure you have a concrete plan for the next steps for treatment.
Thank you. So I'm going to hand it over to Jan. Same question. What's the most important thing to you during this time for self-care and wellness for your fertility patients?
I think it's hard to single out the most important thing, but I think one really important thing right now is that I think people really have to give themselves permission to feel how they feel. I think right now we're filled with so many, you should, you could, you should, we're hearing so much. We are for the first time in I don't know how long around to listen to all the TV broadcasts, to the radio broadcasts, to you name it. There's somebody telling us what we should be doing and how we should be feeling. And I think it comes down to being good to yourself and allowing yourself your feelings. These are challenging times. Acknowledge it.
Yeah.
Be there. Let it happen. And then it gives you the strength once you say, yeah, this is hard. Then you have the strength and the wherewithal to move forward and do what you need to do to survive this awesome period. And it is an awesome period, isn't it?
Yeah. And then to Mary, same question. Okay, I won't say most important, as Jan was saying, but what's important to you, to you for the wellness and self-care of your fertility patients right now?
It's a very perfect question. And I really want to thank you for asking this because, and I wholeheartedly agree with Dr. Sharma and Jan in terms of, I love the word pause because this is a global pause and it's a forced pause and it allows us to go back and reflect within ourselves and look at our lives and beyond fertility, right? Yes, fertility is it's a layer of stress on top of this COVID. And so we need to acknowledge that, as Jan says, and feel what we need to feel, and also be able to breathe and open ourselves up. And, there are things that we do in Chinese medicine for that, but we can discuss that later. But I think pausing and breathing and resetting is valuable at this time.
That's such a great advice, Mary, and all of the advice that that you guys just said, because it's true. Being a former IVF fertility patient myself, the combination of mental wellness, as we say, self-care with trying to get pregnant or conceiving, or even during this time, navigating. There's so much navigating right now as a pregnant woman of what's going on, and just lots of changes and pivots. So how to deal with those as well, constantly changing. So I love that you guys are here all together. I love the Eastern and Western medicine perspective coming together, because I think that's so important. And that was really important in my journey as well. And one of the next questions is, how do the three of you marriage the different aspects of being an RE, a counselor, and a Chinese medicine practitioner to help with self-care and wellness for your fertility patients, working together? I think Dr. Sharma, you were talking a bit about that, but it'd be lovely to hear how everything can be married together, bridged together to bring that all together. So I'll start with Dr. Sharma.
Sure. So my role is predominantly the medical piece as the IVF doctor. And so, of course, when I'm following up with a patient or in consultation with a patient, I'm primarily speaking about the medical aspects of treatment, whether that be stimulation in IUI or IVF. But what I find is that patients often do, on their own accord, seek out Eastern medicine, acupuncture, and they typically, which I was quite surprised at when I came from New York to practice in Canada, I was quite surprised that most patients do have a naturopath even before they come to a fertility doctor. So what I have really learned to incorporate in my practice over the years is that both of those things can happen in combination and in parallel. But what the most important thing is to make sure that there's full disclosure so that your naturopath knows what you're doing in the fertility clinic and your fertility doctor knows what's happening outside, so that all the medication, all the treatment can be in agreement. And I think they really should be complementary. So we really try to go hand in hand with Eastern medicine. And, you know, even if patients don't have an Eastern medicine doctor, I often will suggest it because I think there's so many benefits. And like I said, it is really data driven. There's lots of data to support the benefits of things like acupuncture and holistic therapy. So I'm fully supportive of that. And in terms of, you know, mental well-being and self-care, you know, same thing, very data driven, that stress levels are not going to be ideal when you're trying to conceive. So we are very open to suggesting that our patients speak to one of our fertility counselors. And the way I preface it to patients is not that, oh my gosh, we think you have anxiety or depression. The way I phrase it to patients is, you know, I can tell you the science. I'm here to tell you the science and how the drugs will work and how, you know, we will get you pregnant with medications, because that's really what we do, and with procedures. But I'm not the expert in treating the stress that one goes through when you're doing infertility treatment. And I acknowledge that that stress is there. Just being an infertile patient is stressful in and of itself, not to mention the situation that we're in right now. So I'll offer an appointment with one of our fertility counselors to all my patients, because they just give you a different perspective on the journey. And patients may tell things to the counselor that they would never tell their doctor. And I know Jan, this is a good segue into what Jan might think. She often will tell me that, you know what, the patients come and they tell me things about their treatment that they might not necessarily share with the doctor, maybe for fear that it'll make them say, oh, I'll give you less drugs, or, you know, we'll do something different. And so I really think, again, same thing, that speaking to someone to really maximize your mental health is really going to be complementary to whatever we do in the clinic.
So that's great for Jen, because
I'm going to just segue right back in there, because I think that marriage is based, as all marriages, whatever they should be based on honor and respecting. And I think the way that we from our disciplines work well together is that we honor and we respect where each one is coming from. Well, I can honestly say, over all the years that I've been working in this field, I have heard more different strategies attempted to cope with fertility than you can ever imagine. I can probably go all the way from A to Z for Prati, or A to Z for the rest of us Canadians, you know, with what people have tried. And I think that what I have learned over the years is that there is no one right way, that you have to find the way that kind of resonates well within yourself, that also comes back, in addition to honoring and respecting the others. This is my New York background. My hands never stop going. Instead of honoring and respecting, you also have to honor and respect where you are at. And that seems to be the message that I'm saying over and over. But you have to be able to go, yeah, I'd really like to try that, and feel that I'm going to give that a try. Or you may hear something else and think, no, that doesn't resonate with me. And again, honor and respect that. And I think that's the most important words when we're thinking about how do we keep moving forward with all the different professionals that are there to help us.
Right. Great, thank you. And Mary, I'm going to hand it over to you.
Thank you. And so Jan, I love what you say, because it's also the importance of looking within and seeing what you're willing to do. And sometimes at different junctures, you're more open than maybe in the beginning of their journey. So for some women, I'll hear, oh, there's no way, I'm never gonna go for IVF, or I'll never do surrogacy, I'll never do donor. And 1 or 2 years in, things change, right? And so I myself, who was, no way, Jose, I'll never do IVF.
Yeah.
Well, it became an opportunity when it happened, when I had blocked tubes and there's no way that my husband's sperm is going to meet with my eggs. I had to reconsider. And, you know, I could be completely closed and say, fine, you know what, forget it. I'll just adopt her, be child free. And it took something. I'm not going to say it didn't. It took something to have me see that, gosh, maybe if I can pivot and change my point of view, maybe I could surrender to a different possibility. And so, you know, that's with IVF treatment. And converse, it could be the other way around. You're doing IVF, and I've seen that as well. People come and they'll do multiple rounds of IVF. They're stressed to the max, and they just want another way. And, you know, and that's where we would come in. And when people get acupuncture, at least at our clinic, they're there with us for like an hour. So a lot comes out. So it's almost like a therapy session in of itself. But then the acupuncture we see, and perhaps Zuzana, you could attest to that, like there's that relaxation component, and we really drive in and physically help the blood volume grow bigger into the reproductive organs, and induce a relaxation response. Right now, I want to add in, we are in this social distancing time. Our clinic is not open, so I can understand that stress can be impacted even more because you're not going to the fertility clinic and you're not going to the, you know, see and get acupuncture. So now what, right? So I want to tell you that it doesn't mean you stop trying to conceive. You can still try on your own, and you can still optimize doing things that you can do on your own. And I know Dr. Sharma is doing virtual consults, and same with Jayne Silverman, same with myself. So it's not that we're not available, we're just doing it differently. So, you know, reach out to all your resources. So no, I can't do acupuncture, but I've discovered, and I've been like, you know, racking my brain, how can I serve you better? So I found this thing called acupatching. And in fact, I'm wearing one right now. So
yeah, show us.
And it's very fascinating. They have like over 80 research studies on this. And basically it's phototherapy. They're taking this crystalline structure from, let's see if I can find a patch. And it's photobiomodulation. So the body heat transmits electromagnetic waves, and these patches inside have a crystalline structure, so it absorbs and then reflects back. So it creates a frequency wave, and then your body will have this capacity to heal. So it works similar to acupuncture. And so I thought, well, there's nothing to lose. So I'm still in the trial period. So hence I'm using it. My daughter's using it. My husband's using it. My parents are using it. And it's been really fantastic. So I'm all for it, because like we got to do something, right?
Right. And that's what I was going to say. Thank you for saying that, like what is available right now for your self-care and your wellness, what is possible with the fertility journey. So that's great. So hopefully once you trial that out, send it out to the patients. And you're, Dr. Sharma, you're doing, and Jayne, you're doing virtual telemedicine or counseling.
Yeah, so I can comment for a few seconds, because you're absolutely right. I think part of the current stress for patients is that with this pause, they're worried that they're losing time. And I think as fertility doctors, we're very concerned that patients feel that way as well, but that can always increase anxiety levels for the patients. And so what we're trying to do is be available for our patients. And yes, as you said, we have virtual telemedicine consults and follow-ups available. But what I found, now that it's been about 2 to 3 weeks of telemedicine, what I found for patients that makes a difference, in addition to obviously having resources like Jan and Mary available, it's with their fertility doctor creating an actual concrete plan. So they feel like they have a sense of control. So for example, if I have a patient who was planning to do IVF, but now she's pausing, I'll have the discussion with the patient about what she can do, taking supplements, potentially trying naturally with the aid of low-dose fertility pills at home. And then we talk to them about the actual concrete plans for the fertility clinics. Now, a lot of this is unknown depending on how COVID continues, but I've been telling patients, because this is what's happening in real time, that the fertility clinics are not just pausing now. Now we're starting to talk about how safe reopening looks like. And so hopefully, whether it be 2 weeks, 4 weeks, 6 weeks, now we're actually developing a plan to open up and offer treatment to perhaps the patients who are more at risk, older patients, lower reserve, potentially open in a calculated way where we won't have huge numbers of patients in the waiting room in the morning, but we'll still be able to offer treatment in a safe manner to protect both our staff and the patients and the healthcare workers. So that in and of itself, telling patients, okay, this is your plan. You're going to start with an IVF, hopefully in the next 2 to 6 weeks. We're making a plan to reopen. If that doesn't work, you'll do a second IVF or do a frozen. That just helps patients have something concrete to hang on to.
I love that you mentioned that. Sorry.
Can I jump on that for a moment when you talk about plan? Because I'm finding, during this time, my goodness, I've never been in the house so much in my life ever, and not going out. But I'm finding myself using strategies that I've talked about with other people, and now I'm doing it myself, and I'm finding that really interesting. So when I'm talking about plans, one of the things that I've started, and I can't believe I'm actually doing this, is that I've started my my journal of the plague year. Okay, and I love little books, but it's not just a journal. On a page, I'm writing down recommendations of books that people are recommending, or Netflix things that I'm never reading, never watching. I'm writing odd journal entries. I'm making all kinds of neat little notes about things. And one of the things that I would be writing down if I was a current fertility patient is that I would start writing down my plan. I would start writing down things that I can concretely do to feel better, to work towards myself, work on myself. And I think that the actual written word, and I'm strong about this writing, and I hope no one can see what I'm actually writing.
You mean you can't do it on your phone in notes?
No, because there is something so awesome about taking a pen and writing it down. I've written down recipes. I make lists of people that I want to touch base with. Because don't you all go through a day thinking, oh, I should have. And then at the end of the day, you wonder, what have I actually done today? I don't know about the rest of you, but I'm finding that some days, one day slips into the next and I'll think, what am I accomplishing? But I have my little book.
That's that's
I'm
awesome.
telling
Good idea.
And it's giving me such joy. And someday it's going to go on my shelf. And when I go back and remember 2020, I'm going to have this book that's going to help me remember the things I did to help myself. And concrete things are so important when we're dealing with the unknown. Right now, everything is so not concrete.
It's true. So don't forget, we're going to wrap this up probably in about 5 minutes. Please put your comments below, your questions for all of the 3 of you, and we'll be answering as much as we can in about 20 minutes. Anything that is unanswered or commented, you guys will go back to. But I was going to say, back to Dr. Sharma, it's true. I think anxiety is created not knowing when this will end. It's not about the situation. It's about not knowing. And that's a great, with what you said about having a plan. I think that's a great thing. And also, the journal is amazing. And we're going to talk about, I want to go back to that after about the journal, but it's nice. Thanks for Mary for bringing that up. What is possible right now? And I think that's what people want to know. And thank you so much for bringing light to both of what you guys are doing with virtuals and and showing off your what you're doing as well. So we're going to, being book and brunch, one of the things we talk about is book recommendations. So it kind of was a nice segue again, Jan, into that. I'm going to start with actually I was going to talk about Mary's Pathways to Pregnancy because that was one of the books that changed me. And, going to a fertility clinic, and I'm going to preface this to Dr. Sharma, it's very, very clinical. It's very, very scientific. Okay?
100%. I agree with you.
As a patient. So a lot of women's eyes are down. There could be so many different emotions going through a woman's mind when they're there. People don't necessarily want to talk to each other. They're just kind of like, I want to be in and out. They spend a lot of it, which is interesting because they spend a lot of time there. You could be at the clinic maybe 1 to 2 hours waiting, like, every other day. It just depends on the schedule. So I think I love this conversation because what really changed me was I was doing a lot of Eastern medicine with naturopath, but coming to Mary and talking about the wellness and the self-care that I had to do mentally. And that really changed it. And like, I always say this, and I said this in the last talk, what changed me is when Mary said, make space for the baby. I'm like, what do you mean? I'm making space. But I really wasn't. And then really just listening and reading other stories in your book, Pathways to Pregnancy, which is a beautifully written book. I always say it's like the chicken soup for the pregnancy soul, and talks about different women and their positivity. And like, there's always hope and there's always positivity, and saying you're not your diagnosis, and really sticking to that and believing it. You could say it, but you need to believe it. And then back to what you were saying, Jan, one of the things I love, there's this thing called the 5-minute journal. And it's the second book recommendation, I would say. And it's amazing. It's 5 minutes out of the day. And it's what it also could keep track of what you're doing during this time. But it talks about, and it's an AM, PM routine. And it talks about what you're grateful for in the morning. You wake up, you're like, what am I grateful for? You write your daily affirmation. And then you end the night saying what great 3 things happened. It can be really simple. Hey, I made it out for a walk today during this time. That's what it could be. It doesn't have to be huge. I, got to Zoom with my family, or got to talk to my family. And then if you had anything different, how would you change something? And that's not to be negative. It's just like, that would reinforce the positivity for the next day, and like subconsciously when you're sleeping to make it different for the next day. So I love the 5-minute journal. It's available everywhere. Amazon, Indigo has it. So that's kind of my book recommendations. Those are the 2. Obviously Mary's. I always talk about Mary's book. I love it. So thank you for writing that, because it's amazing. But I'm going to go and start with Dr. Sharma. Do you have a book recommendation? It doesn't necessarily have to be a fertility book, just any book that would help patients for self-care and wellness during this time.
Okay, well, that question is catching me slightly off guard for 2 reasons. One is, since if I have time to read, it's a medical journal.
Okay.
2 is I had to think a little bit. So actually you tipped me off to something that a friend who's actually a cardiologist gave me last year for my birthday, last year or 2 years ago. And you probably have heard of it. It's called The Happiness Project.
Yes.
So she gave me the book and the associated journal. And it's very similar to what you're talking about with the 5-minute journal, where each day there's a question like, what was the best thing that happened to you today? Or write something funny that a family member did today. And, I haven't been super good about it. So one journal for 1 year will probably last me 5 years, but it's the same type of thing, just to sort of reflect on your day each day and think about something good or something that you could potentially improve for the next day. And I think, a lot of times, and particularly in this time, each day just passes into the next, and we don't really sort of stop and smell the roses and sort of think about what happened and sort of cherish it. And so it just like struck me that this book is very similar to what you're talking about. And it's a way that we can sort of practice this like well-being and self-care on a daily basis. It's not like some big aha moment. It's something you can do that's simple every day to really have mental stability and happiness.
Exactly. And that's when you're talking, Jan, about the journal, like exactly, even 5 minutes, right? You don't have to have a commitment, because I think some people are like, oh, for me to commit 20 minutes to something is just super overwhelming in this time. So I'm going to bring it back to Jan and to say, what's one of the books that you...
Well, I took the book thing differently, but I want to add one thing about what Prati was just saying about having, a book for a year that's probably going to last her 5 years. I think the important thing is that, again, I'm always into setting reachable goals.
Mm-hmm.
I stress that, as people that attend groups and have met with me know, I'm all about being realistic. So I can tell you, in all honesty, my partner and I, just about every night, we end our night by saying to each other, what was one good thing about the day?
Oh,
Not
nice.
3, not 5, because sometimes it's hard enough to find one.
Okay.
One I can do. Sometimes, and I know the idea of picking 3 or 5 is really learning to appreciate the minutia. I get that, but it can get daunting sometimes. So honest to God, we have been doing this for years, and it's been awesome because it's a nice connection before you go to bed.
Yep.
And it helps you go to sleep thinking of something. Oh my God, who's calling now? Who is actually using the telephone in this day and age? Everybody. So I think that, hurry up. I love live broadcasts. So I think if you give yourself just one little thing, one of the things in my little notebook that you're all going to go out and find a little notebook. And by the way, don't necessarily make it a beautiful cover. I'm known to say, get one that doesn't have a beautiful cover, because when you have beautiful covers, you find it hard to write nasty things in it. Because you think, how can I take this beautiful book and write, I feel awful? So it's kind of a nice plain book.
Okay.
And to write in. But I found myself also listing gratitudes, which I'm not that kind of a person usually, but I felt the need to do this now. And I will just tell you, for the women in the listening audience, one of the things that I wrote down that I was grateful for, I don't dye my hair. And if my hair gets an inch longer, no one's going to notice. So I can do without going to a hairdresser for a little while longer.
Nice.
I don't have to touch up any roots. I'm grateful for that. So find the things, whatever they are, really important.
Perfect.
Okay?
Okay, thank you. And Mary?
Yaakov.
First, I want to comment. Thank you so much for reading my book. And I love it that you call it the chicken soup for the pregnancy soul. It's so wonderful. It's amazing. And so I want to make a comment about this. So, when you say a book, some people might go, oh my gosh, I don't know if I can, that's just another thing, right? And so what I want to say is I've always been attracted to print books. I like the opening the pages. I like to sniff the pages. I like that tangible thing. But somehow with the busyness of life, I actually got into Audible books.
Yeah.
That's changed my life.
Yeah,
right?
it's so good for multitasking.
Yeah. So for those of you that, are thinking, oh, I don't know about this book thing, just actually know that Audibles can literally change your life.
Yeah. It's thank you for, that's so good that you suggest that. I was just talking to someone about that, and it's a book a month, and yeah, you could be cooking, you could be cleaning, you could be doing whatever. It depends how you multitask. But yeah, definitely, you could finish a book in a couple days if you wanted to.
Totally. Because I was that person that, I would pick up a book and it would maybe take me a year to read it because, we're all busy.
Yeah.
And now I can literally go through books very quickly. As I was commuting to work, not now, doing other things, I can still do that, which is fantastic. So just so you know, I have been working diligently on creating the audio version of my book with my voice. So that's literally in the works, and it'll be coming out in a month or so. So I'll tell you when it happens. And
I love it.
Yeah, so that'll be fun. But in terms of another book, aside from recommending my own book, there's different ways I can go, right? Like the more fluffy stuff, fun, or serious, or fertility. But I kind of like Dr. Sharma and Jan. I don't want to talk about fertility books, really.
Right.
This is a time to really go within. And so you were both talking a bit lighter. So you know what? I'll pick one that I actually had two. I love The Alchemist. It's
love.
And I have to tell you, I never read it in the print version, and I heard it through Audible, and it was Jeremy Irons.
Yes.
So amazing, so powerful. So loved it. And so, and that's talking about your personal legend. And I love that expression as well, right? Like, who you are, one's destiny in your life. And so it makes you think about your purpose and what you're pursuing in life beyond fertility. So I
have a funny story about that book. So before I met my husband, my ex-boyfriend read that book and then dumped me, literally, like ended the relationship 2 to 3 weeks later. So I hate that book. But anyways, that's just like my personal thing. I thought I'd share that. But hey, it led me to my husband, and here we are. So it's it's just a sharing story.
I love that. We all interpret things differently. So this is where I was going to give the second recommendation. And so maybe that is for you, because it's actually called The Book of Forgiving. Are you familiar with that?
I am. You've mentioned it to me before, but please,
okay.
but please explain it to everybody, because it's great.
So it's this little book, and it was written by Desmond Tutu, who's the Archbishop, and in the days of apartheid, and he wrote it with his daughter. Oh my gosh, I cried in every page, but I didn't understand why I would read it in the first place, but it was a recommendation by Brene Brown, who's an author I love as well.
Yes.
And so it was one of her top 5 recommendations. So I thought, okay, well, Desmond Tutu, he's a big name, so why not check it out? I was brought to tears every single page. And what I also got out of it for people in this audience, it's like, you know what? There's forgiving others and forgiving yourself, because sometimes there's a lot of regret, right? It's like, oh, why didn't I start earlier? Or forgiveness of your partner. There's always something. So I think it's a brilliant book.
Thank
Everyone
you.
should.
Yeah, no, I love that. I had to preface the alchemist because about that. But and we're gonna end it here, because we're gonna go to our Q&As. There's a couple questions and comments, so we're gonna go to that, because we do want to keep our time to the limit that we said, and we're already 40 minutes in. So there you go. It just flies when you're having fun, right? Okay, so also I was gonna say on our website, book and the letter N brunch.com, we have amazing reads, 33 reads that you could read during this situation, and it's anything to make you laugh. I think laughing is really good in this time. A lot of people forget about that. Laughing inspires you, soothes you, learning, and goes on from there. So check that out as well. But let's get to our Q&As. There's a couple that came in, so I'm just gonna read them and vet them and see what we have here. Okay, so it's more, okay. So this is for Dr. Sharma. All right, that is wonderful news. So I think it's when you were talking about what currently can happen and the planning of what's going on with fertility patients now. We're with Create in London, and we're supposed to do a funded transfer this month. So we've been left hanging as to what might happen. Should we follow up with our doctor here, or will they be reaching out to us?
Yeah, it's a great question. I think, and a common one actually, it's difficult with busy fertility clinics for us to reach out to every single patient. But because we're all doing telemedicine and there's not that many patients coming through the clinic aside from caring for our pregnant patients, we're very available. So I would suggest reaching out to the clinic. The only caveat I would say is that some of the smaller clinics, perhaps like Create London, I'm not sure, they might be completely closed. But because they have a relationship with our clinic, you could certainly reach out to Create in Toronto, and probably one of Dr. Liebrecht's staff, because he's the one who covers Create London for the most part, could get back to you. But just in a nutshell, I can tell you what you'll probably be told if you connect with someone either at your own clinic or at Create. And the funded program is actually a big source of stress to patients. And I can understand that, because, they're on a list and they're waiting and they're hopeful for a cycle, whether it be fresh or frozen. The funds haven't come into the clinics yet, and that's probably because the government is quite busy with the current COVID pandemic. But we are very reassured that the funding program will continue this year. And at this point, it's a little bit of a moot point, because we're not actually starting any cycles, whether funded or non-funded, at this very moment. But rest assured that the funding, like more likely than not, 99%, just like every other year, will be coming in. And once we do open up, and as I said, there are plans in place to start making protocols for us to start treatment safely. Each clinic will be deciding how many frozen transfers they start, how many fresh IVFs they start. I can tell you that in my practice, what I'm doing is I'm keeping a running list of all my patients who are starting IVF and frozen embryo transfers. And in my practice, much like other practices, what the plan will be is when we actually start opening up, I'll look over that list and say, okay, well, the 42-year-old who needs to do IVF probably needs to go earlier than the 30-year-old who has much better ovarian reserve. But when I say that the 30-year-old will be a little delayed, that's probably 1 to 2 months at most. It's not like 6 months. So yes, in answer to your question, please do reach out to your clinic and to your doctor. The likelihood that they're doing telemedicine is probably high, and they can have a consult, much like, this Zoom session, where they can create a plan for you and review what's happening specifically at that clinic. So definitely I would reach out.
So that was from Allison, and she has a further question to that.
Sure.
And actually, Stacy just added very similar questions. So we're going to just kind of do a 2-for-1.
Sure.
So what factors are you looking at for it to be okay for procedures to start up again? I'm 38, turning 39. And then Stacy's like, yes, please. What are the factors that will mean it's safe?
So safety can be measured in terms of safety of the healthcare workers and the staff that are at the clinic, safety for the patients, and then general societal safety. So the parameters that we're looking at to open up are definitely what's happening with the curve of COVID. So as long as the government imposes a true state of emergency and things are escalating and cases are increasing, the likelihood that we'll open up full force is probably much lower. However, as fertility doctors and as all healthcare professionals, I think we all realize that this can't go on forever and that COVID is not going to go away. So it's not something like where we have COVID today and tomorrow there'll be no COVID. So we do really have to think of ways that we can safely begin to start treatment. Now, I'm sure you've heard many, many world leaders say the world is not going to be the same again for at least a year. So for every business, we're going to be handling things differently, whether it's schools, it's teaching, it's grocery stores, it's hospitals. It's not going to be the same in business as usual as before. So we need to adapt to this new environment. And that's what we're doing. Now, with regards to which patients will be starting first, well, I think that's going to be slightly clinic dependent and practice dependent, but the CFAS, which is our governing body, as well as the American Society for Reproductive Medicine, both of them have created COVID task forces, like actual committees that are trying to standardize what the rules will be for clinics across the board, because we don't want one clinic saying this is okay and another clinic saying something else is okay. So we want to standardize as much as possible, how many patients should come in, how many cycles are okay to run, how many staff workers can be in the clinic. Obviously, it's not going to be the same for every clinic. The volume will be different. But I think what we all agree on is that urgent cases would be women who are older with diminished ovarian reserve. And as many fertility patients know, a 30-year-old could have low ovarian reserve as well, just like a 42-year-old can have low ovarian reserve. So it's going to have to be the doctor's discretion as to who in their practice needs treatment sooner. But, this is what we're trained for. Cancer patients or patients who are at risk of losing their fertility because of treatments that they're going to undergo, they'll go first. But again, we're not talking about 6-month, 1-year wait list. It's just a calculated start where we're not going to open the floodgates and have hundreds of people in the clinic, because as you can understand, that's not going to be safe for the progression of the disease either. So our goal is to keep everyone safe, but also offer patients the treatment that they deserve so they can keep going towards their goal.
Awesome. Thank you for answering that. That was great. This is just a nice, really comment from Nicole. She's like, hey, everyone, met Mary at the infertility show in Mississauga a while ago. So knowledgeable. Wish I lived closer. So that's really nice.
Thank you.
And then she says, I was at a fertility clinic trying to get me to ovulate, but I was not happy with the results. And after talking to Mary at the infertility show, I realized I was not happy with the clinic I was at. She doesn't mention the clinic. I was in the process of going to a new clinic when COVID struck. I'm currently have PCOS and do not ovulate. Anything I could be doing or trying at home for you, Mary, until I get back into a clinic. Tubes look great and open, and I have lots of eggs. Just trying to see what what can be done at home right now in isolation. And I think you guys kind of talked about that, and I think it'd be nice to. It's almost that marriage, right? So starting with Mary, and then talking about the marriage of everything.
Well, with PCOS, there's different kinds of PCO. And but a lot of times there is good evidence that just lifestyle and dietary changes can really impact one's ability to regulate their menstrual cycle. So I don't know your specific profile. So that would be individually assessed. right? So if oftentimes there's an association with blood sugar imbalances or sensitivities. So we would look at that with regards to how you're eating and how you're exercising and create a plan around that. And in terms of, if we were physically doing acupuncture, again, we would literally increase blood volume to the ovaries to help induce periods. So, there's the acupuncture, there's Chinese medicine, there's supplementation, there's diet, lifestyle, exercise, right? And again, short of the actual acupuncture, now we go towards acupatching.
That's what I was going to say, because the question is about isolation, right? So we can't go see you in person. Do you feel that the acupuncture would be something that could help? I mean,
so trying to use the acupatching, and then again, going back to the lifestyle dietary piece.
Can I add one thing?
Well, go ahead.
Yeah. Because I know Prachi's going to give a really good medical answer.
Yeah.
I just want to say, from an interpersonal relationship point of view, have sex. Go ahead, Prachi, take it away.
Well, so I was actually going to extrapolate on that a little bit, in that it sounds like this patient has, if you've had an evaluation at another clinic, I mean, I'm doing a lot of these consults right now. You can actually have a second opinion with the doctor at another fertility clinic right now, and you have all your records. So you could send those records over. For example, let's say if you were seeing me by telemedicine, what I would say is I'd listen to your prior workup and your history. I would get your records from your previous clinic, which we can still do during this period. And some clinics like ours are still doing some diagnostic testing. So if you needed to update anything like blood work or anything like that, you could come in if you feel comfortable. We are minimizing the numbers of patients who are coming in, so it would be, reasonably safe, because you wouldn't be in the clinic when 20 other people are there. So our patients do feel fairly comfortable coming in for blood work. And, some doctors like myself do feel comfortable prescribing things like metformin, which can help induce ovulation in patients with PCOS. Inositol is a supplement that's very good for PCOS. It's a natural supplement that has actually been shown to be equally as efficacious, if not better, than metformin in resuming normal menstrual cycles. And it's actually way better tolerated. And if you were more anxious to start on fertility medication, we are actually giving, patients who have documented open tubes and have irregular ovulation with PCOS. I'm very comfortable giving low dose fertility pills like letrozole to take it home and to practice exactly what Jan said, timed intercourse. Like, don't discount the ability to get pregnant with good old fashioned timed intercourse.
Totally. Yeah. And you know what, Dr. Sharma, I love that you added in the myo-inositol, because not everybody tolerates metformin well anyway. And so thank you for this. So it's not necessarily just always metformin.
No.
Oh,
no, but not every.
No, I love that. So, so that's great. So, I would say reach out to both of you, right? If that's like something that Nicole's interested in, because she says she does live far. So, but that's the great thing about telemedicine now, right? We have this. So
yeah, absolutely.
Everything becomes closer. A very similar question from Crystal. I'm 30, PCOS, 1 tube that's left working, and I'm metformin. Starting from 3 weeks ago, is there a slim chance of natural pregnancy? Well, I think you guys kind of answered that, right?
Well, I think it's important to understand that every patient's history is going to be a little different.
Right.
So it's hard to give complete blanket statements, but in this situation, a little bit older age, potentially a tubal issue. Again, it would be a discussion with your doctor. I believe you said she's with Dr. Foreman?
No, I'm 30, PCOS.
Okay, sorry.
1 tube is not working.
Okay. I thought I heard the doctor's name.
Yeah,
okay.
and metformin is.
Oh, metformin.
Yeah.
So again,
similar.
metformin, it sounded like Foreman. So I think, again, have a consultation with your doctor. Like, this is what all my patients are doing. So I would have a telemedicine consult with their doctor. They'll go over the chart and, you can decide, is it worthwhile taking some ovulation induction with low dose fertility treatments? There is a block tube, so there is a potential risk of an ectopic pregnancy, but you have the age of 38. So time is, you don't want to waste the time. So you might be willing to take those risks and still try with ovulation induction. And if not, again, it's all about making a plan. It's all about saying, okay, well, we know you're 38, so you're going to be top of the list if you want to go to IVF because of the blocked tube. And let's make a plan that when we open up for full treatment, you will be starting IVF. It's, just make a plan with your doctor and be ready to go.
I think she is a current patient of yours, so I think that's something you guys could discuss.
Absolutely.
Crystal. Yeah, and she's 30. She said so. Yeah.
Okay. Yeah.
Okay,
sure.
but right, Crystal, am I understand that you're a current patient? And she comments. Yeah, and then just because we're actually approaching time, we're 8 minutes away. It goes by so quickly. I think the biggest thing is all these, and it's hard to obviously put medical disclaimers here and all that stuff, right, without looking at the individual cases, as you guys were saying. What's the best way? Because some people do want to get in contact with everyone. Do we could put the contact information there, or how do you guys want to handle that?
I mean, I can start in terms of getting in touch with the clinic.
Yeah.
You can certainly call and speak to one of the secretaries, or patients of our clinic are pretty aware that each doctor has their own set secretary. So you can email the secretary/assistant. Like my assistant's name is Melanie, and I'm very happy to have her email given to potential patients or patients of mine. So they know how to reach out. And then what usually happens is within 24 hours, the assistant will leave the chart on my desk and I'll give you a call back. Otherwise, they can email the cycle monitoring team. There is an email for the cycle monitoring team. This is pretty much for existing patients. For those patients who are not patients of Create that want to become patients of Create, again, reaching out to the clinic by phone, there's someone there every day. They can take the information and set up a consult. Because we're not doing procedures, we're very available to do consultations, and they're much quicker than outside of this scenario. So, usually we say there's like a 6-week wait list, but right now we're, seeing patients within the week for telemedicine.
Wow. Okay.
And for those patients who aren't patients of our clinic, I think most clinics are offering the same type of services. So if you connect with the clinic, usually many of these clinics will have like patient portals or emails to reach out to. I think the doctors are very, very open to do a telemedicine follow-up and sort of make a plan that's right for you based on your history.
Great. And then Jan, how can everyone get in contact with yourself?
Well, if they're Create patients, then they can certainly contact Create. Create has an on-site, on media counseling department. So there are a number of counselors that are available to meet with patients. We also have started a new Facebook page called Creating Support. And it is open to anybody that wants to join. So it's just started up, and I'm really going to encourage people to look for us on Facebook. It's a private, closed, one of those group, but we will certainly let you in. And it's going to be a good way for people to share and to learn. And we're hoping to have some online support group that takes place very, very shortly, just as a means of other people connecting with other people. Because I want to just take this opportunity to state how important it is for people out there to be speaking to somebody that gets them. We all know how isolating and difficult it is to go through fertility challenges, and how hard it is to speak to only a fertile population about what's going on, because they don't get it. And people in this stage, especially now, when you're not sitting in waiting rooms together, when you're not attending your normal support groups, you wind up not having the same network often of people that you can just reach out to. And how many times did you strike up a conversation in the clinic and you thought, gee, I wish I had her email address now, and you don't. And that's part about what this Facebook page is going to be about. But I think it's really important to make sure you find somebody that isn't going to challenge what you're feeling right now, is going to allow you to feel what you feel and be able to encourage you and move you in the right direction that you need to be.
Thank you. And that's tagged, right? On our live, all the pages are tagged, so you guys can find that.
Yeah,
on
even the creating page.
yes,
And
the creating page that you just talked about. So that's
so
great.
Jan, I want to thank you for creating this, because one of the things that I don't like is when people go down the slippery slope of just going on any old chat group. And with what you're telling people, it's moderated. You have a professional guiding the group. So it's not this, whole thing of negativity, right? So you add to this conversation. Because when I was going through my fertility journey, I never went on chat groups. And it was only when after was done and was researching for my book, I went on these chat groups and I was horrified. It's like everybody's bad experiences and negativity. So I think having this kind of moderation of a group, like through a professional health, especially a mental health profession, then that will be much more of a positive conversation, right?
Yeah.
We hope.
We hope.
And yeah.
Every conversation with Jan is a positive
Yeah, and
conversation. I can attest to that.
Exactly.
And it's very much needed in this time, for sure. So Mary, how can everybody get in contact with you?
Okay, so thank you. And you can email me directly, MW as in Mary Wong. So mw@aliveholistichealth.ca. So whether you want to do one-on-ones, or if you want to, actually you can scroll down. Like I said, there's like 162 now, including today's post, lots of information on fertility and in a positive light. And also last 3 weeks ago, we created the first live event. It was 2 hours long, and that was called Connect, Calm, and Control in Challenging Times. And we're doing a follow-up, and that's going to actually happen next Tuesday, April 21st at 3 p.m. And we're going to shorten it up to an hour. And well, we'll see what happens, but there's again, there'll be 4 of us, and maybe Zuzana, you might want to participate in that.
Yeah.
And it's for fertility-based conversation. And in that one, it is hands-on, like, what can you do right now to help calm you? What can you do right now to take back some control in your life? Because there's a lot of things that we cannot control, right?
Yes, it's true. Yeah, so that's our hour. So yeah. I think there's more comments and questions, but I think that's something that you guys could go back to and just answer. But that's why I wanted to take this time and just get the contact information of everybody and how people can contact you to further their journey for self-care and wellness. And just want to thank everybody for joining us today. Again, we talked about books. Books are a great way to take care of yourself, self-care, wellness. If you have the time, Audible's great. What Mary was saying, if you don't have the time, and then just check out our list on bookandbrunch.com, what to read. And just want to end this amazing fertility talk. Thank you so much, everyone, for being here and giving your time and helping fertility patients on this journey of self-care and wellness. So,
well, you know what, Zuzana, thank you, because you're giving back, and you don't have to do this. So thank you.
I want to give back. I've been there, and I've just given you guys snippets of my own self, like wellness and things. And I believe it takes a village. We've always in the past lived in a village, right? So now we need to bring us all together to make sure everyone gets the support they need. So I'm happy to do this.
Yeah. So I want to thank all of you all for participating. And of course, this event wouldn't be great without our audience too. So thank you for watching. And again, this is a continuous process. I was going to slow it down, but now with the COVID thing, I'm going to continue doing weekly fertility talks because we need that support. So watch next week, and it'll be with actually Dr. Dixon at ANOVA. And we're going to be talking and continuing this conversation. And like I said, next Tuesday is our live event during the day at 3 p.m. So contact me, get information about that. And in the meantime, share this with your friends. Share this with
Remember, there's the share button. Everybody share this. These are such helpful conversations to have.
Yeah, and it'll also live on YouTube. So if you have people that says, oh, I don't go on Facebook, you can go on to my YouTube channel. It's called Meet Mary Wong. And again, all of the posts are there. Thank you.
Great. Thanks.
See you guys next week.
Thanks, everybody. Good night.
Thank you.
Good
Take
night.
care. Stay healthy.
Thank you. Take care.
Bye-bye.